Sister Callista Roy was different than the other system theorists, as she, instead of thinking as the patient as a behavioral system, thought of it as an adaptive one. Callista Roy is one of the world's greatest living theorists. While she praises many mentors for their help, her mother was the first one to introduce her to nursing. Roy credits her mother for instilling the values of always seeking to know more about people and their care. She first started out in the nursing field as a pantry girl, then as a maid, and then finally as a nursing aide. She became a sister after joining St. Joseph of Carondelet and has been a member for over 40 years. Roy started her college education by getting a Bachelor of Arts degree with a major in nursing, followed by a master's in pediatrics and sociology, and then finally a PhD in sociology. Sister Callista Roy created the Roy adaptation model, which is a theory she is constantly updating herself. Roy's adaptation model, or RAM for short, provides a more holistic focus of care. RAM has been in use for over 35 years. It has been used for providing direction for nursing practice, education, administration, and research. Roy focuses on the individual and group and the stimuli in their social setting and environment around them.
Sister Callista Roy theory developed the Roy adaptation model, which is based on the belief that the human being is an open system. Roy considers the patient has an adaptability in overcoming the problem as a living system, open and able to adjust. The system responds to the environmental stimuli through the cognitor and the regulator coping mechanisms for individual and the stabilizer and the innovator control mechanism for the group. The responses occur through at least one of four modes, and that are physiological, physical, self-concept, group identity, role function, and interdependence. Let's take the closer look at the actual model of Roy adaptation. First is the stimuli, which affect the patient or the situation. Once the input occurs, it's gonna to be affect four adaptive modes, and that are physiological physical adaptive mode, self-concept mode, role function mode, and interdependence mode. Once the stimuli occur, it affect all these modes and may affect at the same time or at the different time. The coping process occur after that all these steps, and nurse is gonna be a response. Responses may be fully adaptive or ineffective. The responses in these modes are usually visible to others and can be identified as an adaptive or ineffective. For instance, Roy's adaptation model was effective to improve fluid intake and creatinine among patients with chronic kidney disease. Undergoing pre-dialysis and patient adherence to fluid intake is crucial for maintaining kidney function. Person as an adaptive system. Roy's also created this model. As you can see, input is gonna occur. There is gonna be stimuli, which is that adaptation level. There gonna be coping mechanism and regulator cognitor, which gonna be control perceptive, like how patient gonna respond. Then effector are all these modes I talked about. Then it gonna be output created, which will be adaptive or ineffective response. And then feedback occur, and then process gonna be started all over. Now let's see about the key concept of the adaptation model, and that are person, health, environment, and nurse. Let's begin with health. Health is not freedom from the inevitability of death, diseases, unhappiness, and stress, but the ability to cope with them in a competent way. Person are biopsychosocial beings who are a whole comprised of parts and are living complex adaptive systems. Environment. The environment is defined as the conditions, circumstances, and the influences that affect the development and the behavior of human as an adaptive system. The environment is a stimulus or input that require a person to adapt. These stimulus can be positive or negative. Roy categorized these stimuli as focal, contextual, and residual, and I will discuss about these stimuli in detail in next few slides. Focal stimuli are that which confronts the human system and require the most intention. For example, when doctor said to a patient, you have a colon cancer, then the individual is a focal stimuli. Contextual stimuli are characterized as the rest of the stimuli that present with the focal stimuli and contribute to its effect. For example, the patient with colon cancer thought, I need to work to support my family. How will I manage that with all these treatments? And these are all other stimuli that are affecting individual. Residual stimuli are the additional environmental factor present within the situation, but whose effect is unclear. This can include previous experience with certain stimuli. For example, same patient is suffering from anxiety, stress, workload, family problems, money problem, and all these are the environmental factors that are affecting the patient. Nursing goals promote adaptation within the four modes of adaptation. The first mode is physiologic physical needs. In physiologic physical needs, nurse need to check about air, elimination like diarrhea, nutrition, afraid to eat, activity and rest. Self-concept means self-image. When the patient think about his or her image. For example, the patient with diarrhea think, these bouts of diarrhea at work are embarrassing. I don't even want to go to work and need to explain why I'm gonna so long and often. Role function means family role. When the same patient think, I'm a father, husband and a sole provider for our family. I'm afraid of losing my job and not being able to take care of my family the way I should. Interdependence means sport. When the patient think, my wife is sportive and willing to go back to work, but I'm estranged with the rest of my family.
Let's take a look at how Sister Callista Roy views the individual in care. An adaptive one, a biopsychosocial being in constant interaction with a changing environment, possessing a unique inner spontaneous expression reflecting the sacred depth of each person. An identifiable role in society, a member of an interdependent group forming meaningful relationships with others. So how do Roy's views of the individual translate to nursing practice? To promote adaptation with the changing environment, then we must consider the individual as distinctly unique in both body and mind, envisioning the environment and struggles through the eyes of the individual. Residual stimuli in the patient's environment are closed factors affecting the current situation. These are beliefs, behaviours and personal experiences that originate from the past and affect the response to treatment. Since residual stimuli are closed factors, they are not something we can change. They are a part of what makes up that individual. Therefore, in nursing practice, we must seek to understand using therapeutic communication. The individual's role is necessary for social integration. This includes primary roles, the role of gender. Secondary roles might include mother or father, and tertiary role is your job or perhaps your volunteer position. In nursing practice, communication is required to assess insufficiencies in fulfilling roles and lately incurred stressors, then to help problem solve. Nursing interventions may include options for childcare while the parent is healing, evaluating support systems, encouragement to speak to the employer, or perhaps guidance in a more permanent role adjustment. As part of an interdependent group, The basic requirement is the creation of a sense of confidence by relationship integrity and improvement of relationships. This focuses on interactions related to love, respect, giving, and receiving value. Nursing practice and interventions may include forming an environment where all family members can express their feelings. Family members are assisted to identify their support systems and utilize when needed. Evaluating if the individual's interfamily role has changed due to disease and how adaptation to this could be defined. Encourage spending time with family, share problems and create solutions. Nurses may also give education to family members.
After hearing all about Sister Callista Roy and her adaptation model, we will continue to learn more about its process. RAM, or Roy's adaptation model, is still a widely used model in nursing schools and hospitals. RAM has 6 steps of nursing process. First is assessment of the patient's behavior. Second is assessment of the patient's stimuli. Third is nursing diagnosis. Fourth, setting goals for the patient's health. Fifth, intervention to take actions in order to meet those goals. And lastly, evaluation of the result. How about we use a sample scenario? In this scenario, Mr. J. Santos, who was living alone at his home, suffered a fall during the day and he had to be taken to the hospital. We will be doing his nursing diagnosis through RAM. Watch how we apply the nursing process step by step. First step would be to assess his behavior. In this one, we found out that Mr. Santos is not receptive of care from home care before and was taken out of the service prior to the incident. Second step is to address the patient's stimuli. One factor that affected him was his wife's death, as she was his main caregiver when she was alive. Third is the nursing diagnosis. For this scenario, there were 2 diagnoses, and those were, number 1, acute pain related to soft tissue damage on the left hip and arm, as evidenced by pain and facial grimacing. Number 2 is risk for falls related to weakness. Fourth step would be goal setting, where goals for his care will be discussed with healthcare team, including his family and Mr. Santos himself. So his goals would be, number 1, soft tissue damage will be healed by December 15th of this year, and number 2, maintain safe environment for client at home. The 5th step is intervention. It determines how best to assist the person in attaining the established goals. So for Mr. Santos, it was established that he will have number 1, minimal movement to rest on left arm and hips, and also cold packs for same area for 20 minutes at a time. Number 2, client agreed for home care visits to help on ADLs. And the final step is evaluation. This involves judging the effectiveness of the nursing intervention in relation to the behavior after the nursing intervention in comparison with the goal established. Mr. Santos' arms and hips were healed, and there had been no more fall incidents since home care started helping him with ADLs and meal assists every day. He had also been attending Adult Day program, which he loves as he can now socialize with people his age.